we are having our first webinar, virtual COVID-19 event, and all the folks who have responded positively to our invitation. We're so pleased because we know that you have very busy schedules, and we recognize that we've set up a time of from 4 to 5, and some of you might have to jump on and then jump off the video or the call, but we're so delighted that you're here. We at Interfaith Works, I know most of you know about us. We have almost 50 years of history serving the most vulnerable in Montgomery County. And over the years, we have heard the voices of so many people about what it means to be poor in Montgomery County. And we also are aware that with COVID-19, some of those same voices that have been speaking out to us are voices now who have questions about what it would mean for them and their communities. And so we will be having an opportunity for some conversation between some of our county leaders and some of our faith communities about the work that they are doing and seeing in their role as serving people in need. So I want to turn things over right away. I'm Rosetta Robinson. I direct the Emergency Assistance Coalition, working with some of our frontline workers who are helping people with food and prescription and housing needs during this time and throughout the year. And I want to just turn things over now to our CEO, Shane Rock, who is going to give us a little introduction to some of what we have learned over the years about those who are in need in the county. Now, I want to just pause a moment to say that James Stowe was to be our moderator. And I think there's some little event going on at the county council that is keeping him from maybe joining us. And so I'm just sort of stepping in. We may hear from him, and at some point I see that he's maybe trying to connect by audio, and he will also be able to be involved in helping with answering any questions and responding. So with that said, and I don't see Reverend Stowe at this moment, I'm going to then just move right to our CEO, Shane Rock.
Thank you, Rosetta. I really appreciate it. It's a pleasure to be here with all of you. And thank you very much for taking part of your some time this afternoon to spend some time with us. Interfaith Works does three things. We prevent people from falling through the social safety net. We stabilize housing and families, family situations, and we help empower people to lift themselves out of poverty and homelessness. We serve 17,000 Montgomery County residents every year with services designed to help them escape poverty or homelessness. It's really important work, and all of you are part of it. So we're really thankful that you are here with us today. I want to take just a moment to sort of frame the conversation around disparity and equity and COVID-19. So I'm going to share my screen. And so those of you on the phone, I'm phone only, I apologize, but you won't be able to see this. I want to just run through a couple of maps for folks. First one is really a poverty map that many of you have seen before. And what this represents is poverty rates by census tract in Montgomery County. The darker the red, the higher level of poverty. The dark red areas are poverty rates in Montgomery County that are higher than the US median. So these are, for Montgomery County, these are fairly high poverty rate tracts. Now second, I'm gonna move to a slide that illustrates where people who are not white or Hispanic live in the county by census tract. The darker the blue color in the map, the more people who are non-white or Hispanic. So the greater the black or brown population. The third map overlays COVID-19 cases, confirmed cases by zip code. Now I want to add, this is not, does not control for density within each zip code. So this is just a raw look at how many cases actually appear in each zip code. Note that these are the 12 areas that have the most cases by zip code in the county at this point. actually as of last Friday at 10 a.m. And they correspond very much with the areas that are considered most diverse in Montgomery County. They also coincide with those areas of highest poverty. So on this map, we have both the racial diversity of the county represented and the poverty overlaid on top of that with the COVID-19 cases. So when you look at this, you cannot help but ask yourself, why are these areas, these zip code areas, these parts of our county experiencing a higher incidence of disease than other parts of the county? Part of our discussion today is really exploring why that's so and talking about what we ought to do about it. So with that, I want to introduce our next speaker. We're honored to have Maryland's junior senator, Senator Chris Van Hollen, join us today. Senator Van Hollen's been a great friend of Interfaith Works for many years and a great friend of Montgomery County. We appreciate your leadership and look forward to what you have to share with us today. Senator Van Hollen.
Well, thank you, Shane, and thank you and Suzanne Lofhelm and your entire team at Interfaith Works for everything you were doing before this pandemic hit and all the emergency efforts you're undertaking now to try to make sure that we address the needs of people who are most in need. I also want to thank Dr. Robinson and the others on this call for their good work. And I know we're going to be hearing from our county executive, Mark Elrich. I want to thank him. We've been in regular communication really from the very first days of this pandemic. I want to thank him and the Montgomery County Council and everybody who's pulled together to try to address the needs of our neighbors in the county and around the state, and in fact around the country during this difficult time. And Shane, as you mentioned, this pandemic has really shown a bright light on a lot of the disparities and inequities that we've known exist and have been working to try to address over time. But this really shines a harsh light on many of them, including the disparities in our healthcare system, in our education system, when it comes to things like the homework gap and the digital divide and distance learning, to the housing situation and so many others. And of course, we also see it in the numbers of people who have been hit the hardest by COVID-19. And that map you showed underscores that point. I organized a letter on behalf of the federal delegation some weeks back asking Governor Hogan to release the Maryland data based on zip code. And I'm pleased that he's done that. We've also pushed the Centers for Disease Control to make sure they do that on a national basis so we can first learn about what's happening, who's most impacted, but also to help govern our decisions about where most of the assistance and help needs to flow. So let me just mention a couple big pieces. We, of course, have the battle against the virus in terms of trying to bend the curve and treat those with COVID-19. And Congress has now passed 4 bills in a bipartisan manner that address different pieces of this. The CARES Act, which was the biggest piece of legislation, provided substantial funds, a $100 billion fund to healthcare providers on the front line. So community health centers, hospitals, senior living facilities, all of them are going to need more help to support their patients. There, of course, has been an incredibly frustrating shortage of things like personal protective equipment and testing, which is not due to a lack of dollars, but really due to a lack of national production and supply chain. And we are pushing the president to do what he's not really done, which is fully utilize the Defense Production Act. So those are all the efforts at trying to defeat the virus and care for those who have COVID-19. Then, of course, there's the economic relief package to try to provide a safety net for people who are experiencing the economic fallout because of social distancing rules and other precautions. And I'm happy to answer any questions on those. Many people have heard about the Paycheck Protection Program for small businesses and nonprofits. There's an emergency loan program from the SBA. There are the individual checks that went out, $1,200 per person, $500, $1,200 per adult, $500 per child to people within eligible income ranges. One of the most important safety net provisions really is the unemployment compensation provision, which both increases the weekly amount that someone can receive on unemployment by $600 a week. That's funded by the federal government. And importantly, we open eligibility to unemployment compensation to people who'd never been eligible before, self-employed, independent contractors, gig workers. Now, there's been a huge problem in getting the Maryland site up and running through the Maryland Department of Labor. But I do want to underscore the fact that once people qualify, and I realize how frustrating it is, and there are people who are experiencing severe cash flow problems, but once you qualify, you will receive those benefits backdated. That's $600 a week backdated. Just two other things I want to underscore. One, and this was something that the Trump administration originally opposed including in the bill, but there is a significant down payment, and I want to stress down payment, for state and local governments in the CARES Act. And as a result, the state of Maryland will be getting $2.3 billion, and counties that have over 500,000 people, like Montgomery County, will be able to draw directly from the Department of Treasury. And again, I want to thank our county executive and county leaders for putting together the plan to do that. Montgomery County will receive $181 million from that fund. Now, we wish that fund was much more flexible. Under that provision, you can use those funds to pay for things that you had not otherwise expected but for COVID-19. But you currently cannot use it for deficits that you may run that were directly caused by COVID-19. So we need to correct that in the next bill. But in addition to the monies that come directly to the counties as kind of a stabilization fund, there are increases in important community programs. CDBG grants, very flexible. Montgomery County will receive $2.9 million there. There are grants to address emergency homelessness. Montgomery County will receive $2.8 million there. Montgomery County school system will receive $39 million to help it through this period of time. And there are many other programs. The one I want to close on is food assistance, because we've all experienced and seen long lines because people are in real need right now, even more than usual. And so the different pieces of legislation that were passed included a number of things, and we need to do more. But what they included was with respect to the SNAP program, we increased that by $15 billion, and we removed some of the restrictions on access to SNAP funding. Now we're trying to increase the SNAP benefit by 15% going forward and increase the minimum and do some other things. Second, in the earlier bills, we did provide substantial new monies for the child nutrition program. This is the school lunch program. And right now, families across Maryland are able to go to the designated schools to pick up that food. We plus that up by $8.8 billion. There's the WIC program as well, for women, infants, and children. That was plussed up by $500 million. And finally, there's the emergency food assistance program, where between the second bill and the CARES Act, we plus those up close to $1 billion, about $750 million. Those are the foods that come through the local food banks. So those are really important because they, of course, can be provided to all families. Let me just close by, again, thanking Interfaith Works and thanking the county executive and county council, because there are certain populations within our state and county that don't receive any of these federal benefits other than some of the emergency food benefits, through the through shelters and food banks, and health through the community health centers, but otherwise no support. And I want to thank the county for moving to address those needs. And thank you again, Shane and Interfaith Works, for bringing us together today.
This is important, and we thank you so much for what you've shared, because Montgomery County being unique, we've got so many who fall through the cracks, so many gaps that we need to close. And then we also have the new needy that are surfacing, and especially with COVID-19. So, and I know that there's CARES Act, and there may be a CARES Act 3, 4 down the road. Are there any particular areas that would be very beneficial to Interfaith Works and Montgomery County that you haven't mentioned that may be on the horizon that we would need to also do what we could to advocate for?
Sure. Well, let me start with support for state and local governments, and we need to both increase those amounts, but also allow those funds to be used much more flexibly, so that more funds would flow to the Montgomery County, and then the county, with input from groups like Interfaith Works, can decide where the needs are greatest. So we really need to plus that up and make it more flexible. Number two, a number of us, Sherrod Brown, myself, and others, are working on an emergency rental assistance fund, because while we've been successful for the most part in requiring forbearance on loans and non-evictions during this period of time, and been able in many cases to stay and postpone payments that are due, what may happen in many cases is people will owe this large lump sum at the end of the period of time without having the income to make those large payments. And so we're working on that piece as part of the next round. And then I mentioned some of the changes with respect to food assistance, trying to increase the amount for SNAP benefits by 15%, trying to increase the floor amounts for SNAP benefits. So those are some of the big issues. I'm also working to try to address this homework gap so that we can connect more students to their classrooms via the internet. Those are a number of the things we're looking at, in addition to the healthcare pieces, in addition to trying to make sure that we can stand up rapid, comprehensive testing, which all the health experts tell us is absolutely essential to safely reopening as we move forward. So those are some of the elements, and I welcome any other suggestions as we go forward. Our Senate caucus has regular virtual discussions with respect to priorities for the next round. So I welcome any ideas that people on this call may have.
Thank you. Thank you. And we hope to be able to share those. I know that Reverend Stowe, are you on the line, or we just see that you might have signed in? And I'm stepping in for Reverend Stowe. So I think this is a good place then to ask the county executive to share some of his thoughts around the COVID-19, and particularly in our work and our concern with poverty, and comment on anything that the senator might have said. And then we certainly will then segue to Dr. Gales and then Dr. Cole.
Good. Well, first of all, thank you all for putting this together. I've been doing lots of Zoom meetings, and I find them to be really helpful. It's been a pretty effective way of being able to reach out and talk to people in the community. And I'm glad that technology has at least evolved enough now that we can do things like this. This is much better than a phone call, frankly. Mm-hmm. So I appreciate everybody who puts this together. I'm always happy to see the senator here or any place. And they've done a fairly amazing job at the federal level in terms of trying to create programs that'll be of use to local jurisdictions. And I've been telling people that I was very pessimistic about how this would all turn out. And I mean all, not just the virus, but all the impacts of the virus. 4 weeks ago, I have felt a little bit better as Congress has been able to act and get programs through. I think there's a way further that they need to go. There are problems that are, I'd say, untouched. The rental support for people, particularly undocumented people, is an enormous problem, not just in Montgomery County, but some other counties in Maryland and across the country. And getting small business assistance into the hands of really small businesses continues to be a real challenge. We know that that Montgomery County businesses didn't fare stunningly well in getting the appropriations from the federal government in the first round. And it wasn't that they didn't apply, but they either had snafus with the banks, they had uncooperative banks, or when the money ultimately got out there, a lot of it was used up by companies that probably should not have gotten it and left a lot less for people who we think should have gotten it. The county is, we were the first place that was hit with this. We had the first 3 cases, I'm forgetting that, was it March 5th or something like that? We acted pretty quickly. And I remember, I think about that in the very beginning when we had the incident with people going to this home in Rockville, facility in Rockville, and apparently exposing people, and the kind of decision we had to make when Travis describes he gets an envelope from the state with 31 test kits in it. 31 test kits, and that's the extent of our test kits. And he's got to decide who gets tested and who doesn't get tested, because we have other tests and other people that we have to test. And that's just, making decisions like that is painful. I try to remind people that I feel that we are making decisions based on resource availability a lot of times and policies, rather than what are the best things you would do if you had the resources. We would have done more testing a long time ago. We would have passed out more personal protective gear and probably put it out more widely had the gear been available. But we were making a decision like everybody else in the country. We're not in any way unique, that the equipment had to go to the people who were on the front lines and most likely to be exposed. And that meant there wasn't equipment around for everybody. So those kind of decisions are painful. There's no joy in that decision. And it's, I think, a really tough decision for the county to have to make. We have we are launching or have launched a couple of programs. We've got a small business assistance program, money up to $25 million. I suspect it'll grow a little bit more than that. We are approving things as I speak. Checks will go out to $10,000, up to $10,000 checks will go out to people who qualified for less than $10,000, and then we will be also distributing checks to people who've qualified for between $10,000 and up to $75,000. Montgomery County's program is probably the most generous in the region. DC's program was $25 million, limited to $25,000 checks as grants, and Prince George's County's program was smaller than ours in total dollars and was limited to $10,000 grants and $100,000 loans. So our money is all grants, and the sums are larger, and we are trying to serve as many people as possible. We had 6,800 applicants for the grants, and the money will not cover 6,800 businesses. So we're going to continue to look to see what else we can do. We also are launching our assistance program for individuals. And the good thing about the federal unemployment is that it's available. The best thing will be when people can actually go through the process online and get qualified for the checks. But it means that a lot of people who are unemployed are going to be getting checks that are $600 larger than they normally would have been. And to put that in perspective, the average Maryland check was $385. The maximum Maryland check was $430. Now you add $600 to each of those checks. And that's enough to make a difference between paying rent and not paying rent. The problem is there are a whole bunch of folks, undocumented folks in our community and across the state and across this country, who worked every day, paid their dues, paid taxes, and are ineligible for any of the unemployment benefits. And from our perspective, this means that the dollars that we have are going to be more focused on those residents in the county who have no income support. and we're thankful that there's decent support for the residents who qualify for unemployment. If you're out there, it also includes 1099 workers, the self-employed, and the so-called gig economy workers. But it's going to enable us to take our resources and apply them to the people who are out of work. I continue to talk to the governor and try to talk with them about what they can do to provide support on the wage front. There has not been progress there, but they did share with us all the programs they have for which documentation is not required and for which people can apply for assistance. They are aware of this challenge and they're aware of other challenges. I'll say the last huge challenge we face is test kits. And I think, the governor's move kind of epitomizes the challenge. He came back from South Korea with 500,000 test kits. The test kits didn't have swabs or the reagents to run the tests with. So we're still waiting to find the swabs and the reagents, or I should say the governor's staff is waiting to find the swabs and the reagents so the tests can be given out and the tests can be used. We are also working on the constraints of the guidelines for testing in Maryland, which still requires a physician's reference to that. I think that's correct, still requires that, Travis. And we've asked the state that if we secure our own supply of test kits outside of the state's supply, can we adopt broader guidelines? Because we'd like to do deeper, wider testing. We need the state to say we can do that. And then after that, we need to ramp up. We've brought on another supplier this week. Travis can talk about that. The other two large companies, which is what Quest and LabCorp, have more availability than they did before. So we're able to get more testing put in place in Montgomery County. And we're looking for more opportunities to expand testing beyond that. And I will say that our relationship with the governor has been actually really good. We have regular meetings with him or his staff. He's got a person assigned to be in the contact for the county executives. We have been able to make suggestions and sometimes see our suggestions embodied in the governor's proposals. It's all been very cordial, and I think what I appreciate most is, unlike the man in Washington, he has said very clearly that the opening of the state is going to be taken in consideration of the health needs of the residents of the state first. And he's not going to speed an opening in the name of opening up business for the purpose of opening up businesses if he's not confident that we can open up and secure the safety of our county and state residents. And so I appreciate that perspective because it makes sense. It's a guideline we can work with, and we're going to continue to give them input as they start weighing how they'll open up. And I'll stop there.
Thank you. Thank you,
Thank
Mark.
you so much, County Executive. And before we move to Dr. Gales, I have a quick question for you. I know that we set up a food insecurity task force, and I'm wondering if there are plans to establish one that would address housing security or eviction prevention, since we have so many of our low-income community at a housing burden. Are there any plans for that?
So our housing department and our social service agencies are working with people on housing. The governor has stayed evictions, so nobody's going to get evicted while the emergency lasts. Everybody's terrified of what happens when the emergency ends and if landlords come and ask for back rent and people don't have the money to pay the back rent. And that's especially true of the folks who haven't had any incomes, that weren't eligible for unemployment. So that's, like I said, this is where we're trying to focus our resources for support. We're going to need more help than we can give. And we're going to need landlords, I think, to accept some level of forbearance, because if people don't have the rent, it's going to be very difficult for them to find the rent. And if they're displaced and evicted, that doesn't mean there's going to be a tenant to go fill that space. And it seems that people in some way would be better off getting on with life once this is lifted and people can go back to work and collecting rents from then on, than being fixated on whether I can get the back rent. And I think that's true both for both individuals and for commercial properties. Vacancies, whether it's in commercial sector or the housing sector, are not going to be good for anybody. It's either going to put a business out of work or a person out of a home. Both those things further exacerbate the economic situation in the county. And we'll continue to look at what we can do, and I'll continue to lobby the state for more support on funding for some of these things, particularly assistance. One way we've tried to frame it and is that rather than thinking about it as assistance for tenants, would be to provide money like we are for businesses who aren't able to sell, to allow landlords to file for assistance based on their inability to collect rent, and use that as the basis of requiring that if the landlords collect for rent they can't get, that the tenants be forgiven for the rent they weren't able to pay. Those two things ought to come together, but it may be easier for people to wrap their heads around giving money to landlords than giving money to tenants. And if they can wrap their head around that easier, I will accept that as long as we can get to a solution that helps people.
Thank you. Dr. Gales, please give us an update on the progress of COVID-19 in Montgomery County and especially why we're seeing certain zip codes affected.
Sure. Good afternoon, everyone, and thank you for the opportunity to be here. I will not belabor the point with the numbers, as to say that you can reference the state website and the county website that has extensive maps that breaks the information down by gender, race, age, and zip code now. And so as things have progressed, we have seen the number of cases increase. And what I have been promoting to folks is to follow the raw number of cases, but as was pointed out earlier, when we release the numbers, it does not take into consideration population density. So for example, when we looked at those three zip codes, 209, 02, 04, and 06, when they were originally released, it just said, there's 172 cases here, 150 cases there, 146. But when you look at the scope of the population, now granted, any case of COVID-19 is one more case than we want to see. But when you look at it at the scope of population, those three zip codes, one of them has 70,000 residents, which is more than probably, I think, half the counties in Maryland. And so when you stretch that out, the percentage of residents impacted is actually fairly small and smaller than a number of other places. Now, that said, we do know that we are seeing increased cases in those areas. And, there are a number of factors that can go into that. We've had extensive conversations with our colleagues in other jurisdictions at the state level to try to figure out, are there any particular factors that are promoting transmission in certain places? We know that in Montgomery County, we have a lot of folks who travel internationally. And so going back to the very beginning of COVID-19, all of our cases were tied to travel. And the thought is that we had the virus was brought into the community, with lots of people moving back and forth. And given the increased population density that we have, the fact that we have lots of people moving across state lines and county lines to go to work, we have a large number of folks who are still having to go to work in terms of meeting the essential worker population. And we know that we do have a fair amount in some places where we have certain families, in their family dynamics where we have a large number of residents living in one space. And so to that end, what we have tried to do to tackle that across the county, in particular, focusing on these zip codes, is to, one, build testing capacity. As County Executive Elridge mentioned, increasing opportunities for folks to get access to testing. So we've utilized our vehicle admission station in the White Oak area that is open 2 days a week to do drive-through testing. We've created two other sites, one at the Wheaton Recreation Center and Library that is open on Wednesdays, and another one that went live on yesterday at the Up County Regional Service Center in Germantown. And we also recognize that for many people, particularly where poverty is a significant issue, access to insurance and medical care are significant issues, we're working to remove that piece because testing requires a provider referral in order. And we are working to create a hotline where individuals can call in the county, go through a screening process and get triaged with a medical provider who can then put an order into the CRISP system, a state system, that allows them to be scheduled at any of those alternative testing sites that we have set up. Again, I want to also encourage folks to say that the leading provider of COVID tests is our medical community. And so as we continue to create opportunities and alternative sites for those who don't have resources, I want to emphasize that the medical community, primary care providers, urgent care centers, the network of healthcare providers do continue to offer tests, and that is something that has evolved over time. Now, recently, as of this morning, actually, the CDC has introduced new guidelines to say that we should consider testing those individuals who are asymptomatic and have left it up to the health departments on multiple levels to come up with criteria in terms of who meets that. And so we're working, as the county executive mentioned, we started those conversations with our colleagues at the state over the weekend and are continuing those conversations to figure out who should we be testing in that category who's asymptomatic. Because we want to know, again, the fundamental pillars of pandemic management are early diagnosis and early quarantine and isolation. Because if we can get folks diagnosed early, whether they're symptomatic or not, to know their status, we can isolate them, we can go through and trace their contact networks and let any individual who may have come into contact with them during that time period to quarantine themselves. Again, steps to minimize transmission in their networks. The other thing that I want to highlight and mention, there's many things that we've been working on, but as it relates to this conversation about poverty and equity, we know that there's lots of medical talk about the virus and transmission, but we know a lot of that is influenced by however you call them, social determinants of health. So you mentioned access to housing, food security, transportation, economic opportunities. How do those things play a role in COVID transmission and COVID management? And recognizing that we've worked with the state has introduced these rapid response teams that are being shared with the 4 jurisdictions with the highest amount of cases. To be able to go out and meet some of those needs. And so to triage in high-risk communities, high-risk settings, to assess, yes, are you doing well clinically? Are you exhibiting any risk factors or criteria concerning for having a COVID illness? And what do the other things look like in your life? What's the housing situation? What's the food security? Those kinds of things. And they have gone live over the weekend, and we've already done some work. We've connected one of the teams with our services to end and prevent homelessness. And another one of our teams has been working with Impact Silver Spring. And they've identified a number of families who are in acute crisis related to COVID diagnoses. And our county services have been able to step up and provide additional services. Now, we don't want to lean on only the state resources. Our Health and Human Services team is working to scale up those and build local versions of those programs to be able to provide additional support. I'll close on this last piece. I'm happy to answer any questions, but it relates to the ongoing conversation about equity. We have discussed, and you've seen in other jurisdictions, where there have been significant disparities in COVID-related outcomes, particularly fatality rates. We've seen the data from Chicago, and we've seen the data from Detroit, and we're working to get that data here to be able to build a profile within our county and jurisdiction. It has shown that, unfortunately, Black communities are disproportionately impacted with higher fatality rates. And so the conversation we know is that when we talk about underlying medical conditions, for example, the underlying medical conditions that we've talked about that predispose folks to worse outcomes are things like heart disease, diabetes, asthma, and hypertension. We know before COVID came that there were significant disparities in all of those outcomes that have been noted for decades. And so we hope that with the conversation discussing about how we address social determinants of health and how that impacts acute outcomes. We hope that that conversation continues to create the type of systemic change and structural change that needs to create policies to really make long-lasting impacts. So, and I know that some folks on the call have heard me say this before, so that if God forbid we're talking about COVID-26 or COVID-35, we're not looking at disparities based upon race, talking about these same disparities in underlying conditions. So I'll stop there, but happy to answer any questions from any of the participants.
I have one question, and it relates to, of course, disparities and the symptoms. I'm hearing some new symptoms, and oftentimes, sometimes in our communities where there are health disparities, there are issues where people are not able to have access to medical care immediately, and there's a delay in getting help or maybe testing. So I've also heard about some symptoms such as headaches and other things that they may not be on their radar screen. Someone might have been sick, but they didn't have shortness of breath, so they didn't bother to go to the doctor. And then by the time they get there, it is an acute situation. So just want you to comment on that so that everybody can listen, they can be aware of any symptoms that might be something that they should be checking with a medical provider about.
Sure. So in the very beginning, it was, we had a short list of symptoms: shortness of breath, fever, fatigue, and coughing. And we know that's evolved. Now we've got, there's lots of atypical symptoms: lack of taste, lack of smell, headache, also gastrointestinal symptoms. And then what we're realizing is that there's a significant amount of folks who are COVID positive who have no symptoms at all. Mm-hmm. And so that underscores the conversation, and what we're trying to do is look at data and be able to inform the medical community and the provider community to say, hey, you need to be thinking about these other criteria when you're screening an individual, because we know that we can miss cases, whether, even for a person coming in with symptoms or they're asymptomatic. And it's important that we test to try to get those cases identified early on. So it's a full spectrum of different symptoms that I laid out and you laid out, as well as folks not having symptoms at all. And so hopefully we can get a good set of criteria that works across the board. Providers can expand their testing, and as the county executive mentioned early on in this process, one of the limiting factors was our availability of tests. Now, we've grown from that manila envelope that we received with 31 tests weeks ago to an extensive level of private laboratories that are offering services. And again, that's why I want to emphasize the medical community has access to that. As well as on a county level, we've been looking at how we can work with other vendors to increase our capacity so that we can support alternative testing sites for many of those individuals that you mentioned that may be locked out of the medical community, whether it's mistrust, lack of access to a primary care provider, or lack of insurance.
Thank you. We're going to move to Dr. Kroll next, because I'm just wondering, I know that HHS has been the primary department where many people have gone to when they've had health or housing or needs that have to do with their income status or housing status in Montgomery County. So with COVID-19, what do things look like right now for HHS? How are you all operating and managing, and are you seeing more cases?
That may be an understatement. I'm gonna follow Shane Rock's example and share one thing on the screen with you all, so you can see this and get a sense of this. And I think you should be able to see that. This is we'll do it this way. There, hopefully that'll be clearer. The number of MC311 calls that have come in over the last couple of months that describe the request for assistance, for any kind of assistance that is that we provide, and excluding the housing assistance around this. But what you can see is that from the point of time where MCPS schools closed until now, that number has skyrocketed. It has gone up. And we're seeing that not only in our eligibility and income support pieces, but we're seeing it in our crisis centers. We're seeing it in our requests for substance abuse treatment. We're seeing it in our request for rental assistance and homelessness services. The number of homeless people are not jumping, I think, dramatically, but they're pretty steady. But the folks who are requesting rental assistance, who are utility assistance, Medicaid, Medicare supports, are all kind of going through the roof right now. Think of it as the the back end of, I think I can stop that, stop share, there we go. Okay, I think we figured that as Dr. Gales has talked about surge over the last couple of months, the medical surges, we're seeing a trailing indicator of folks coming in, more coming in the longer we're out, and the longer we're closed down, and the longer we're operating under a state of emergency. Folks in poverty operate on a knife's edge, live on a razor's edge all the time in terms of jobs, economic security, healthcare, nutrition, transportation. COVID-19 has pushed a lot of people over the edge in this instance. I think the good news for us is that throughout all this, HHS is open. We have been open for business throughout all of this, and we continue to be open and available to provide services to folks through this crisis and emergency, but also as it tails off. The reality is we're in this for a long run. The problems that HHS will be dealing with and that the community will be dealing with will last beyond the state of a medical emergency, where we're seeing cases coming in, and then through the summer and through the rest of the year. We'll have folks who are going to lose their jobs and may be at risk for losing their homes, even though there is to Mark's earlier, to the CE's earlier comment, even though they may have may not be, there are no evictions now, the rent is still accumulating, and folks are having to get rental assistance to pay the rent. Those bills are going to come due at some point. If folks aren't put back to work, if businesses collapse, they may not have jobs, they may not have adequate health care. So part of our mission right now is still to make sure that folks are engaged in knowing that HHS is open and know how to get to us. And that information, I think pretty much everyone on this call has access to, but our county website has that information. And if we need to, I can share some of the core numbers around that. But I think we are rental assistance, home energy assistance, income supports, the cash assistance model of income assistance, emergency assistance to families that Mark mentioned earlier is online starting today, or it started up today and will be fully online within the next week to help families and individuals who need that help. Our healthcare access is still open for folks who need Medicare, Medicaid, or folks who are ineligible for that. There is our Montgomery Cares programs that people can go and get healthcare at no cost. The Affordable Care Act has been reopened, and so folks who did not get a chance to sign up through the open enrollment period can still apply for Obamacare and still get access to that. Our crisis services are open 24/7, and our services to seniors, our dental service, and our effort and our rapid rehousing programs. Our shelters are still in operation. Dr. Gales mentioned the rapid outreach, or the GO teams and the rapid outreach teams that are stood up by the state. We're working with them now to identify the folks in the target areas, in the highest impacted areas, who may have been tested positive, or may have had a family member who's tested positive and have been exposed to this, to try to identify the support and human services needs that they need as well. As we expand those teams, we will still continue to target those high density areas of high poverty and high concentration of exposure, to try to make sure that they have equitable access to care and to the support services that Montgomery County has available to them. The CE mentioned the emergency support funding that's being put out. It's important to know that some of our services we help folks apply for federal and state assistance, but some of them are county driven and are eligible to anyone in the county. And when they're eligible, we're not asking about immigration status or any of those kinds of questions for folks. We're serving folks based on their need and are available to try to give them the help that they need to stay safe at home and to get back on their feet. So I think that bottom line is where I started. HHS is open for business, and we will be open for business throughout this.
We're going to have to move quickly to our next panel, but I see that there are a few questions, Shane, that are popping up. If they can be addressed real quickly, and then we've got Tim Warner from Emory Grove and Mill Creek Parish, and we've got Tafael from the Muslim Community Foundation, and also a good priest who's been working with the Catholic Archdiocese and parishioner at St. Camilla's. They all are going to make some quick statements, and we hope that we'll have a little time for you all to ask them any questions. Shane, I know that there was one question in the chat box about how long is this pandemic going to go on?
Yeah, so it says, what are the extreme limits, short or long, of how long the pandemic will be in our focus before we can begin to resume normal routines? Anyone want to take a shot at that?
I'll answer this from the medical standpoint and say this, is that I can't promise you a definitive date and time, but what I can promise you is that fortunately we have the people who are making those decisions are using the evidence and science and the data to inform those policies. And that's important. And so when you hear a lot of us talking about certain numbers, for example, you're going to hear us talking a lot about peaks and surges in the coming days. So when we're saying peaks, that means we've experienced the largest increase of cases and deaths that we think we're going to experience on a daily basis. And from there, the curve will start to come down. Even when we talk about that, we recognize that we're still going to have to keep some of these policies and practices in place to make sure the number comes down back as close to zero as possible. Now, some of the other things that will influence that as time moves forward is how far will science advance? Will we have a vaccine? Will we have more effective treatments in place to be able to deal with COVID-19 cases to keep people from dying? So I know that doesn't give you the answer you probably want in terms of a definitive answer, but a lot of it will determine how things move over the next several weeks to give us a better sense in terms of when some of those restrictions can be relaxed.
Dr. Gales, before you go, let me ask this question too. Is the current rate of hospitalizations in Montgomery County still rising?
So interestingly, the hospitalization rate has actually steadied off across the state. We're looking at probably about 21% of COVID-related cases being hospitalized. Now, what we track is, to be perfectly candid, when we look at, there's lots of data, there's lots of models, there's lots of things that we read. What I'm most closely looking at are the hospitalization rates and the fatality rates, because that gives us a sense of what is the true burden of the disease out there. And hospitalization rates are important, and we follow those closely because that helps us determine how much of a burden on our healthcare system it is. And so we have seen the numbers increase, so the percentage is going to stay the same, but even with the new cases, there are new cases that pop up. So I say all of that to say that the hospitalization rate has been steady over the last week. Our hospitals are handling the capacity where we stand right now, both in terms of general capacity, as well as being able to meet the needs in terms of extended intensive care and critical care services. So we monitor that daily. For now, we are holding the fort. And, as we continue to move forward, and if we need to, that's where the additional spaces in each of the facilities comes into play, and some of the other alternative sites that we're looking to stand up, such as Washington Adventist Hospital in Tacoma Park, to add additional bed spaces.
All right, so we only have about 7 or 8 minutes, unless we're able to extend this time if folks have more time. But Reverend Warner, would you just tell everyone who's viewing, listening, our kind of leaders, what you are experiencing from the vantage point of pastoring in your two congregations, and two different kinds of congregations?
Thank you, Dr. Robinson. I appreciate the opportunity to come on and share. I think most people who know me know, maybe, I don't know who else is out here, but I pastor both a white congregation and a black congregation. One is wealthy, one isn't. And I am sort of reaffirming what I always learned as a former microbiologist, and that is that viruses don't care about your racial ethnic background. And so I've got people in both congregations who are sick. One thing I want to say, though, is that we need to really look past the numbers at the people and what it means for anyone in a household to be in an ICU for an extended period of time. At one congregation, I have a young man who is 17, who is at home by himself and has been so for a week, because his aunt, who is his primary caretaker, and his father, who is at home but not terribly responsible, have both contracted COVID-19 and are currently in Shady Grove hospital with on ventilators in the ICU. And so we have to care as a congregation for that family. How do we get food to this 17-year-old young man in the house where we know COVID exists, where we really can't go? And then how do we get information in this age of HIPAA about his parents who are, about his caretakers who are in the hospital and the ICU? So caring for this young man has become an issue for our entire congregation, and folks are concerned, and it disrupts even more the lives of people. The other thing I've learned, though, is that, and this is also true of anybody who studied epidemiology, the folks who have less access to resources are the folks who are going to get sicker and die the most. And so in my African American congregation, I understand that folks are already used to sort of this pressure. One of the things that my great-grandmother told me when I was assigned to talk with her when I was in high school about the Depression was, after she inquired as to who asked me the question and whether the teacher was white, she began to laugh and she said this, and I hope no one's offended by it. She said the Depression was a white folks problem because Black people had already been in a depression before the Depression. So what I'm finding is that the folks who have been struggling the most are already used to struggling, and this is just another problem for them. But what's going to eventually happen is that the healthcare, lack of access to healthcare and resources to stay away from the virus are going to begin to tell the toll. And I think that's why we're seeing such a disparity in the number of sicknesses and deaths from this disease along racial lines. And so we expect to see that at our congregation. And we've already got funerals, memorial services that are planned for later in the year because we can't do it now.
Thank you. I think that maybe we'll want to hear about what's happening in the with the work that you're doing with Catholic Charities. Friar Jacek.
Okay. Thank you. So I'm with Catholic Charities, but also quite involved, continue to be involved at St. Camilla's Parish and working especially to respond to the situations around COVID-19 as it impacts Latino community. We have seen the increase of the families that are diagnosed with the virus and organizing to provide food for those who are quarantined. And provide some kind of emotional, kind of spiritual support in this time. Also worked with some lay leaders to develop a Facebook page that makes information available, more easily available. The information that we received from Montgomery County and Prince George's County regarding the prevention and some of the help that is available. And the last thing, just want to mention that at St. Camilla's we have developing in collaboration with Holy Cross Hospital, and we have a team of people that will be preparing face masks for those patients that are positive that are being released to communities where they live in kind of high density situations to have the washable face masks. So trying to do what we can to respond, and again in collaboration with some of our partners.
Thank you. So, Mr. Ahmed Tafal, would you like to share in terms of the work that the Muslim Community Foundation is doing? Can you unmute him? Let's see. We may have to come
We may
back
have-
to you.
Yeah, I think we may have lost him.
Yeah, we may have lost you. I'm so sorry. We'll have to figure out a way that you can get into the chat box. That well, as we're sort of wrapping up, this is a wonderful conversation, but we also want to have some conversation. I don't know if any one of the Reverend Warner or anyone else wants to ask a question of these two groups of, we've got county leaders, we've got faith-based folks, and I know that there's some folks who are on the line as well who might have something. But Reverend Warner, do you have a question for any of your county leaders?
I am asking a question out of pure interest and ignorance because I've not looked for the answer. I'm sure it's out there somewhere, but I'd love to see what the demographic breakdown is of COVID hospital admissions and deaths in our county. And I wonder if there is a map out there with that data, so we can do it geographically as well.
Hello, Sabina. Can you correct? Can you hear me?
Yes.
Yes, we can. And as
can I
you're about
speak?
to speak,
Can
I was
speak?
told that Senator Van Hollen needs to leave, so we want to thank him for his time. And please feel free to leave now, Senator Chris Van Hollen. Yes, Tafal?
Yes, I can speak now?
Yes.
Okay. Thank you very much for inviting me. And I represent the whole Muslim community in Montgomery County. Luckily, this is the month of Ramadan, and everybody is opening his heart and helping the people. They are forthcoming. And right now, we just taking care of about 200 families in Prince George's County, Baltimore County, and Montgomery County. They are all refugees, and they don't live in Montgomery County because they can't afford the rent in this county. So we are helping them there, and there are 200 families we have selected and distributing them Ramadan food baskets. Then we have come in Montgomery County, and we are helping about 200 families in Tacoma Park. EduCare and Difference Makes Tacoma. These are the two organizations I am working with them. Then there are 200 families in Burtonsville, and I'm working with Green Castle Elementary School. And right now, the whole day today, I was working with them for the transportation part of it and for putting the baskets and taking it there. So these are all the things we are working. So we will be providing at the end about 600 boxes of food to all these families in Montgomery County, Prince George's County, Baltimore County, and we will take care of them. We are also providing masks to the hospitals because we have a sewing class in our organization. They are preparing it. And then we are also contributing to the shelterless people who are in Gettysburg. We are providing them breakfast in the morning. And lastly, we are providing money for distributing food to the residents in Montgomery County who are elderly people. So this is all what we are doing, and we hope as the demand comes, we will participate more. Thank you.
Thank you so much. I understand that Senator Chris Van Hollen would like to say a word or two before he leaves. Senator Van Hollen?
He's gone. He's gone.
Yes. We can't hear you. Can he unmute him? There you go.
Now?
Yes, we can hear you now.
All right. Well, thank you to Fail and to all who contributed. And thank you for bringing this together. And just to thank Interfaith Works. And our whole team is available to anybody on this call. Let us know how we can help people during these difficult times and beyond. So thank you for bringing us together.
Thank you so much for being here. We appreciated all that you shared, and it all, we did want to make sure that we looked at the three major government entities, federal, state, and our county, local, and we certainly were able to hear about the state perspective from our county executive. So thank you so much, Senator Van Hollen. I almost called you a congressman because I'm so, I remember you so as the congressman, but thank you, Senator Van Hollen.
Thank you. Take care.
Thank you. Reverend Warner, I think you had a question, and do you want to restate it?
I was just looking for the racial ethnic breakdown of hospital admissions and deaths in our county, and to see whether we could overlay that on geography. I'd love to see how our Black, brown, and poor people in this county are faring as compared to everyone else in this crisis. And while I'm talking, we here in Gaithersburg work an awful lot because we have maybe not more than anyone else, but the way my two churches work is to work with a nonprofit up here called Gaithersburg Help. And so we have been just organizing food drives for the entire time. People have been donating money and food and volunteer hours at Gaithersburg Help to care for those who are struggling most the most.
That's Gales.
Yes, so Reverend Warner, thank you for your question. So we have been working to crunch the data to answer the questions that you have. The first question and first level of data that we do have that we were working on today actually is breaking down the deaths by age and race, and should be releasing that information shortly, hopefully having it on our website as early as tomorrow morning. And we've broken that down by raw number as well as rates, because as you know, when the rates are a better way to compare. And so we don't have the overlay of the maps done just yet, but I would point you to some previous reports that we've done looking at health issues, the 2008 to 2016 status of health in the county, as well as we did an analysis, a zip code analysis about a year and a half ago that we looked at health outcomes by zip code. And so those two reports are on the Health and Human Services website. And our goal is ultimately, as we get more cleaner data from the state to break down by race and geography, is that we'll be able to do that and build a more comprehensive profile of COVID-19 in the county.
Thank you. Thank you. You know, Tiffany Ward, I think, are you still present? We see your photo. And, you know, we know early last year and early in this year, the county was really focused on equity. And I certainly was among so many who are advocating for that. And so people have asked questions about how does the impact statements and all this equity work that started out in the beginning such a priority, how is that dovetailing with what's happening with the county government work on COVID-19?
COVID-19 really amplifies all of the racial disparities, particularly around health, that we've been talking about. I think when we first launched the work of the county on racial equity, we talked specifically about the racial disparities, the health disparities between the racial groups in the county. And I think COVID, if it hadn't already been front and center for the county, really did amplify that, and how the importance of dealing with those health disparities and how a pandemic can exacerbate the many diseases that we know disproportionately impacts African Americans and Latinos. So it's interesting, when I first heard that we were going to that this was going to land in the county or in the states, I knew instantly that our communities of color would suffer more. Everyone has kind of spoken to it, but Dr. Gales, Tim Warner, because we disproportionately are affected by diabetes, high blood pressure, asthma, as well as suffer with the social determinants of health, and that we are generally make less money, are housed insecurely, and live in places that don't have parks and cleaner air and things of that sort. So as far as how it's affecting the work in the county, I was, I think, confirmed on the 25th of February. I think COVID's first case landed 2 weeks later. As I tried to stand up the department, it immediately, I will say, shifted my focus to COVID, and working with Dr. Gales and Dr. Kroll around the zip code data and wanting to use that data to really affect change immediately, as opposed to waiting for a report that we could then talk about what we can do in the future. Though I am still setting up the office, still setting up the infrastructure, still working to get our board in place, still working to get further staff in place, and still getting ready for the policy parts of this work. It's been really interesting too to try to help inform department heads on how to make crisis decisions with a racial equity lens, whether it's about how we use transportation or decide that we are going to slow down the usage or the bus service or the ride-on, right? So we know that transportation is a major issue for our communities of color, and that while we had to reduce our service, we wanted to reduce that service to communities who use it to get to the grocery store, to get to healthcare at the very, very last moment. And so we've been trying to help our department heads use a racial equity lens to make those kind of crisis decisions. So that's really where we are.
I'm glad you mentioned that, because I know there are folks in East County who are really concerned about when you talked about transportation, and just even mentioning that the bus routes were changing and all that, that had a significant impact on people's lives.
Of course.
And so, you know, that's a big concern.
Yeah. And the second I saw that this was coming, I started to think about how this was going to impact poor Black or browner communities immediately, and how we could try to use a racial equity lens to make those decisions. And to be honest, it is just me right now in the office, and I am trying to insert myself into as many conversations and as many decisions as possible. And so it's been a challenge, but I think that this is really putting equity. If anybody thought that this was not something that the county should be doing, or something the county should be doing tangentially to other work, it has really amplified the fact that equity should be front and center in all the decision making.
I really want to thank all of you. We've gone past our time that we were to end at 5. I know that there were 1 or 2 questions and 1 or 2 faith communities folks that we had invited. And I just wanted to, I don't know if they are on the line or still on the line. Judith Clark with Women Who Care Ministries. I know that they have been giving out thousands and thousands of boxes of food to help people in need. And I've talked with them about what they see as the new needy. People who, because of so many changes in the household, because of COVID-19, more people are home, more people are that the demand for food has probably increased. We also had Jackie Denard from People's Community Baptist. Are you still, I think I saw a question or a statement from her in the chat box, Shane. Did you want to share that, if she's still there? Jackie? Well, then this is fine, because I know she was talking about some needs around data she also would like to see. So as we wrap up to close, I don't know if there's any other parting statement anyone has, or Shane, do you have a kind of a question or something that we don't think we covered?
I think this has been a fascinating conversation, and I think we probably need to do this again, because this is an important topic. It's one that's continuing to evolve as this disease continues to ravage our communities. And so, I want to thank everyone for participating today. Interfaith Works is on the front lines of addressing this along with all of you. And we need your partnership in order to be successful in helping people who are disproportionately affected by this disease and by poverty and homelessness. So, we really appreciate everyone for taking the time to join us, sharing your thoughts and your interest. In terms of the questions we weren't able to get to today, we'll try to get answers for you and get those out to all participants in today's call. So we really appreciate you.
Thank you. Have a good rest of the day, and we will be back in touch with you, because this was our first one, and so there are more to come. Thank you.
Appreciate your time. Be well.
Yes. Have a great rest of the day and evening. Thank you.
Thanks, everyone.
Okay.